talking about the medical system in third world countries, citing Nigeria as a typical example. A lot of us from third world countries have adopted this general belief that the best medical care in the world is found in Western world, which may not be too far from the truth. But what baffles me is the fact that our leaders, whenever they are sick, they are running abroad for medical care. One will wonder what measures they are putting in place to ensure that the same care they get outside the country is gradually being implemented back home. Instead of flying out today, the next time you're sick, you fly out again. The next time you're sick, you fly out again. True leaders lead by example. So one will expect, if you think the facilities back home are not good enough, at least you come outside the first time, you see what difference it makes. Try to implement such back home. But that is not the case. Instead, our leaders want to fly out today. Headache, they fly out. Stomach issues, they fly out. The next thing, they fly out. One will reasonably have expected as leaders to be able to put one and one together. These days, we have lots of Nigerian doctors outside the country. So a lot of these leaders, when they fly outside the country, most times their doctors are also Nigerians. In Canada, for sure, I know a lot of big hospitals that have Nigerians heading a lot of the departments. So the question is, if you're flying out from Nigeria to come seek treatment from a Nigerian doctor abroad, or it tells us that the problem is not from lack of intellectual capability or lack of people to do the job, if I may say, but lack of resources or misplaced priorities. Let's take cataract surgery as an example. For me as an optometrist, so this is the one I can actually break down. Cataract is something that everyone will surely get as you get older, which means it's something that one should prepare for. Now, cataract surgery will cost you $5,000 to $6,000 for both eyes if you're doing them together at the same time or within the short time frame. Now, the same cataract surgery can be done in Nigeria for 300 to 400,000 naira, which is less than $1,500 Canadian. It means the rest $4,500 is something that you as the leader that's coming for cataract surgery outside the country could have saved. Minus the cost of surgery alone. Most times when you come for cataract surgery, the surgery will not be done that very day. You have to come in for preliminary measurements first. You do the preliminary measurements, then 2 or 3 days later, before the surgeon decides, okay, I'm going to do one eye, because they're not going to do both eyes the same day, in case there's a problem. So you do one eye, say, okay, let's see how this goes. Then we'll do the other eye, maybe minimum 2 weeks or 3 weeks interval. So for 2 to 3 weeks, you're going to be staying here in an hotel. You're going to be paying hotel bills. You're going to be paying, feeding yourself. There'll be a lot of transportation costs involved. Then, most times when you go for surgery, it's always advisable to have someone with you. Suppose you come in here, you don't have a family here. That means you have to come with somebody from back home. That's an extra cost for the ticket. An extra cost to feed that person, an extra cost to accommodate that person. That extra cost of the ticket and your own ticket alone, we're looking at minimum another $6,000 if you fly economy, which most of them don't do. So $6,000 plus $4,500 difference in the cost of surgery. That's already over $10,000. Add the hotel bills for that period. Add the cost of transport for that period. So for one person alone, it means then now you also have to factor in the fact that if you're doing this back home, you have your entire family support. When you come here to do it, you don't have that. So that means for each person that comes here to do cataract surgery, the difference minimum that you're looking at is about $12,000 to $15,000 for one person. Minimum. Now, $15,000 for one person. How much can it do for us back home? Most times, after surgery, the surgeon still wants to see you within 2 to 3 weeks. Then they do a follow-up in 6 months. If you have a problem, you have to run back. These are all things that, if it's being done in Nigeria, for example, you don't have this unnecessary cost. That's $15,000 to $20,000 extra you don't have to steal from the government treasury. For the period that you are here, you're not working back home. You're losing income. And the sad part is, this whole expense, most times, is borne by the taxpayers. The same taxpayers do not have medical facilities to use. So if one person is $15,000 to $20,000, how many do we have? A lot more than that. So by the time you know what's happening, for just cataract surgery alone, we're spending millions of dollars being wasted. And that's money that can easily revamp one of the medical facilities back home. If you have the facilities in place and you know that you have Nigerian doctors that you go see outside the country, those doctors can easily volunteer, if there are facilities in place, to come in and work for maybe a week or two. In that period, there's so many people that can easily access that care in that short time. Unfortunately, our leaders don't seem to think this way. And that's why we have a lot of problems. I ask myself, is it that they don't know, or this is just selfish interest? Tomorrow, when you're not in power, can you still afford this medical tourism? Then what happens if tomorrow you're no longer in power and you don't have the funds to do this, and you're sick? Where will you go? Because when you were in power, you didn't bother revamping the medical facilities anyway. We have hospitals in Nigeria. I've seen videos on social media where you have government hospitals where when it rains, the rain is falling into the patient wards. The roofs are all leaking. Patients don't have beds. Mattresses are as thin as just maybe 1 or 2 layers of cloth. How then do we expect to move forward? And the sad part is tomorrow the same leaders turn out to tell us that our youths are lazy. It's only in Nigeria where I find politicians earn much more than their mates outside the shows. A lot of them don't even understand how money works. How is it possible in the same country, the businessman has to get US dollars at 400 naira to $1? Doctors don't have facilities to work with. The dollars that that the leaders can afford to go waste on this medical tourism, yet you have businessmen, genuine businessmen in Nigeria that don't have access to foreign exchange at the same rate. So how are you going to create the jobs? How is it possible in the same country, the businessman has to get US dollars at 400 naira to $1? Then the person that is flying, that's going to Dubai for where he or she is marrying a third wife or third husband, decides to fly all the friends, all the guests to Dubai for the wedding. That person can access foreign exchange or the US dollar at bank rate, or even 200 naira to the dollar. Even if both of them are businessmen, the fact that one person is able to buy the dollar at 400 naira to $1 and the other person is buying at 200 naira to $1 already puts one at a disadvantage in the same country. How does this add up? How do you create jobs for our youths when you're having your wedding party in Dubai with all your guests? The hotel that you're going to accommodate those guests gets your money. The waiters and waitresses there gets your money. The drivers that have to shuttle you around in that country gets your money. These are opportunities that could have been for Nigerian youths, at least to be employed during that period or be engaged during that period. But you turn out tomorrow and say our youths are very lazy. What have you done to give them opportunities? Surprisingly, the same youths will pick up guns, cutlasses, and deadly weapons to protect these same leaders. Sometimes you just ask yourself, like, where is this disconnect? Is our quest to solve today's hunger so bad that we don't even see what is ahead of us? How can the same person that put you in so much in a deep hole gives you food for one day and you're still ready to pick up arms to fight for that person, instead of working together to get these guys out? Sometimes I don't get it. And this is just one area, medical tourism. We're only talking about cataract surgery here. Think about how many other medical services that we have to fly abroad for. For me, if you are using your own funds and you want to be flying outside, I don't care. But so long as you're one of the leaders that's voted into office and you're using taxpayers' money, it bothers me. Because I think taxpayers' money should be used for the taxpayers' benefits, not for you. This is a very selfish interest. $20,000 for just one trip. You spend $20,000 for just one trip, or $20,000 difference for just one trip. That $20,000 will go a long way in buying beds for one hospital. Those beds will be used by your own relatives when they are sick. So your relatives that cannot afford to fly outside, they will use those beds when they are sick. But if you can equip the hospital with medication, your family will have access to them. But selfish interests won't let us see these things. People fly outside until they are being treated by white doctors. I guess that was the excuse then, that we don't have the technical know-how to do these things back home. And that's why they have to fly out. That excuse today will not fly. Because virtually every profession that you think about today, you have one immigrant or one Nigerian in that area that's doing very well and has proved him or herself to know what he or she is doing. So let's think about it. It doesn't make sense that in a state, virtually every community that you go to all have dilapidated facilities, medical facilities. Everyone is going to be sick today or tomorrow. So medical services should not be something that, it should be a necessity. It should be treated that way. It's something that, it should be a necessity. should be treated that way. Even if you are not sick, your driver might be sick, even be your security guard at home are sick. And they need to use those facilities. So do something for the people that they will remember you for. It doesn't make sense that you load the treasury for medical treatment abroad when the people that voted you in cannot even afford, go see doctor. Thank you, ladies and gentlemen. It's Dr. Victor Obasuyi. If you have any comments, throw them in the comment section. Like the video, share it. If one person makes a change, it's a change that will benefit a lot of people. And that's the whole idea of this. So thank you, ladies and gentlemen. We'll see you next week.